Thank you, Mr. Bennett. First, I want to address, I'm sorry she's not here, a couple things that Senator Stabenow said, making the point that somehow Democrats are for coverage and Republicans are not, and then worming in there something about an association with segregation in hospitals. As a physician who worked in a public hospital for the uninsured and dedicated my life to bringing access to others who did not have, I take umbrage at that. And I'll also point out that the segregation in the South was by Democrats who were the ones promoting that, and it was Republican judges who fought back, and that it was Dwight Eisenhower that passed the first civil rights bill. So if we want to say that, oh my gosh, we can just promise the store and somehow pat ourselves on the back without consequences or without even regard to sustainability, oh, I'll give that to my Democratic colleagues. And if we want to say, oh my gosh, we were responsible for segregation, but somehow we're going to worm that in, insinuating that we were not, I'll maybe give that to you. But I'm going to let you know that that's not true. That history is wrong, and that history is false. And by the way, as long as we're speaking about sustainability, Medicare is going bankrupt in 2026. And we have a bunch of people who want to expand coverage to Medicare, which will further strain its finances so that those who are on it are less likely to get it. Think about this. Medicare is going insolvent in 2026. And when it goes insolvent, by law, it will only pay the providers that which it's currently receiving, which will result in roughly a 25% decrease in what they shall receive. That will be a crisis of access. And this is the program that the other side is actually wanting to put others on, endangering access for the seniors who are currently on Medicare. Now, again, if folks want to pat themselves on the back for expanding access, let's look a little bit deeper. Republicans are for access, but they're also for sustainability. If you cannot sustain, then you do not have a program. You merely have a talking point for your next election. And in this body, we should be more about sustainability as opposed to a talking point for the next election. So I wish Senator Stabenow were here to hear that because I think it is something which I am glad to disagree with. Now, that said, Dr. Holtz-Eakin, you point out that it's not just about paying for care, it's about lowering the cost and having better quality care. I presume because otherwise it is not sustainable, correct?
That's right.
So I was struck that in Obamacare, that there was a big effort to put on the Cadillac tax to otherwise restrain the amount of subsidized health care because we knew that subsidies of health care drives demand, which overall drives up the cost. Is that a fair analysis?
Yes, that's right.
But Ms. Collins, or Dr. Collins, I'm sorry, you're speaking about how we need to further subsidize health care. That actually seems to go against the principle that the more subsidy, the more demand to drive up the cost. And yes, you lower the out-of-pocket to the individual, but for society, you drive up the cost, which therefore calls into question sustainability unless you have unlimited dollars. Dr. Collins, how would you respond to that?
Well, the new data out from the Healthcare Cost Institute, Senator Cassidy, thank you for the question first, really does show that prices, not utilization, are driving our cost problem in commercial insurance. So increased coverage does do the things.
Let me ask you just a second. I have limited time. So price is not utilization, but there's pretty good data from the RAND Corporation that's kind of a time-honored study that's been showed elsewhere, that if you ask an ER patient to pay a de minimis amount, you decrease utilization without negatively impacting healthcare outcomes for those who do not have chronic illnesses. Now, is it fair to say that in that case, totally immunizing somebody from the cost of healthcare indeed increases utilization and therefore would increase demand, increase total expense?
I mean, health insurance coverage is the most important.
Yeah, but that's kind of my question right there, is if you totally immunize somebody from any cost sharing whatsoever, that you do increase utilization, therefore demand, therefore total expense. Is that not correct?
But none of our insurance plans, very few, except for very low income people, have zero cost sharing.
In the silverization, so I'm told, of the Obamacare exchange policies, there are those who currently do not have any cost share whatsoever. And of course, I'm speaking of the particular of no cost share whatsoever. But at some point, cost share becomes significant enough that it impacts their behavior, correct?
It does, but we know that high cost sharing really discourages people from getting needed care.
So
the
I'm not
problem
talking about high cost sharing. I'm talking about the general principle that the more healthcare is subsidized, the more demand is generated, and the more people become cost insensitive to a higher price. The more they are cost sensitized, and the sweet spot is where it doesn't discourage needed care, the more it is for total global cost. Is that a fair statement?
I think cost sharing is an important part of health policy, particularly for care that's unnecessary. But we do want to make sure that people have the right incentives to get the care that they need.
Totally in acceptance with that. And really, we're talking about sustainability. I'm sorry, I'm already a minute over my time, but I'll just say that if we don't have a sustainable system, everybody patting themselves on the back that they've expanded coverage are really just sowing the seeds for a health and economic crisis. I say that because as a physician in a public hospital, we always ran out of money at the end of the fiscal year. And at that point, we were denying services or postponing into the next year. There has to be sustainability built into whatever we do to expand access. Thank you.